My name is Kelly Roy. Today I'll be presenting on the telepractice training model that we use in our SLP department. Robin Martin will also be here to join me shortly, I believe. She is presenting with me today, and she is planning um, to be here, but she is at our residency on campus this week. And so she's leading a training module there, and it's going over a little bit. So she just reached out to me. So she'll join us when she is available. But I really appreciate all of you being here today. So our goal in this presentation is to share our structured telehealth clinical model, not only as a tool for training speech language pathology students, but also as a framework that can be adapted across healthcare disciplines. Telepractice has become an essential part of clinical care, and we found it to be a valuable way to bridge the gap between classroom learning and hands-on experience. In addition to discussing how our model works and its impact, we also want to explore opportunities for interprofessional collaboration. So if you see a potential for applying this approach in your own field, we would really love to connect. And finally, we want to share our services that we provide. So if you know anyone who could benefit, we hope you'll help us spread the word. So we'll dive in. And as I mentioned, Robin Martin will be here shortly. She is our Director of Clinical Instruction in our SLP department. So she is over all things clinical instruction for our program, and that could be related to clinical residencies, our pro bono clinic. As students move off to clinical externship, she's very deeply involved in how those experiences are going for those students. So that's her role, whereas I am our lead clinical educator in our pro bono telehealth clinic. So I'm involved not only in working directly with students as they go through their first clinical experience, but I'm also there to help support the day-to-day running of our clinic. So scheduling clients, making sure they have all the documentation that they need, getting our clinical educators the support they need to support their students. So that's a little bit about my role. And before I move into the overview, I'd love it if you just share in the chat what your role is and what department or area you're coming from in the university, so I have a better idea of the audience that I'm speaking to. Perfect. We've got a student. Wonderful. Thank you, Solange. I'm an OT student. Great. Right. Thank you so much for sharing a little bit, everyone. That kind of helps give me an idea of what we're looking for. So we've got some faculty, we've got some students. So this is really wonderful. This kind of gives me a better idea of who I'm speaking to there. So, okay. Well, moving on. So this is a brief overview of what we'll be doing today. So I'm going to be covering a bit overview of our SLP program because I feel like it is pretty unique in our university setting. And then talk about where the idea for this telehealth clinic came from. And then I'm going to really dive into the structure and implementation of our telehealth clinic. Then I'm going to discuss some additional clinical opportunities outside of our regular structure that we provide for our students to give them some additional competencies and clinical experience before their graduation. And then we're going to discuss the impact of our telehealth pro bono clinic and then some future directions. And I see Robin is here now. Perfect timing, Robin, because we are right at your spot.
Great, thanks. So just a little bit about our program. Our MS-SLP program is a hybrid program. So you'll see where all of the blue is, that's where we currently are approved to take students from those states. And so we have students from all over the country who complete online coursework. We have both synchronous as well as asynchronous sessions that our students participate in. And then their clinical skills are developed through clinical simulations. So we have those spread throughout the program. We're 5 trimesters long. And so they have clinical simulations in their 5 trimesters. They also come to campus for residencies, which is what I was just running from, where our students come to get hands-on practice with materials, and they're able to demonstrate competencies and skills. We're able to see them in person for that. And their trimesters 1, 2, 3, and 4. And then our pro bono clinic, which we're going to talk about today, is in the 2nd trimester. So all of our students get experience in our pro bono clinic in their 2nd trimester, and then they go out to their clinical externships, which they do within most of them a 75-mile radius of where they live. So the externships occur all over the country as well. And they do 3 total externships or clinical placements, and they're Tri 3, they're Tri 4, and they're Tri 5. And so that pro bono teletherapy experience that we are providing to our students in their second trimester, it's really their first in-person clinical experience with a client prior to them going out to their externship. So in our residencies, we have simulations, and then the online simulations that we do, but they get to actually interact with a real client in their second trimester. Okay, so how this originated, our speech pathology, our speech language pathology program is newer to the university, and we're just growing on the different campuses. But we're really seeing initially that as our students were going out to the externships, some of our externship coordinators, our clinical educators were reporting some difficulties with some clinical skills. And as we were looking at that, we're like, man, we should really have that before they're going out. How do we look at this? What do we do to assure our students have these skills prior to going out to their externship? So it was really a way of addressing a gap in some of that clinical training that they were having, again, to have that experience working with an actual client rather than just a simulation online is two totally different things. When our students come to residency and even interact with a standardized patient compared to the online simulations they're doing, they're like, whoa, this is way different. And then, of course, it's different in pro bono clinic, and then they go out to their externship. So we really wanted to provide a structured clinical experience. We're really looking at their clinical readiness, which we'll go into the details of that, and then really ensuring the continuity of their training. So again, it's very strategically planned in our curriculum. So we do have it embedded in our curriculum. It is part of our clinical courses with a pro bono experience, because sometimes our students who are in their later trimesters, like 3, 4, and 5, they could also see clients if they need additional hours or additional competencies, or if they need, something additional to maybe what they're already doing with their externship. So we really wanted to put it into our curriculum to make it a part of the training as they were going through their different trimesters in the program. All right, Kelly, you want to take over?
Absolutely. All right, so that's a little bit of how our pro bono clinic got started. So now I'm going to explain, what we do in our pro bono clinic, starting with, in general, what it is, especially to our clients. So we are a fully virtual model providing speech and language services. So that means from intake to discharge, our clients meet with us via Zoom. We do not meet with our clients on campus for any of these services. Since we are virtual, we're able to serve clients in several states, and we serve them in Texas, California, and Florida. And we support adults and children who lack access for various reasons. So that could be geographic barriers, such as, they live far away from a provider that would work for them, or they live in a rural or remote location, or they are unable to leave their home. We also serve clients who have financial constraints because, due to the cost of services that may be prohibitive to them receiving the treatment that they need, or they may lack insurance coverage, or even if that they do have insurance, if they have coverage exclusions for speech therapy, or they've maxed out their benefits. Another really great thing about this program is we're able to serve our university community. So faculty, staff, students, and family are also eligible to participate in our clinic, regardless of those other barriers that I mentioned. So we also provide, so I want to talk a little bit about the specific services we provide. And I mentioned if there's someone that, if you are someone could potentially benefit from services, we would love to chat further about the services that we provide. So we offer evaluations and treatments for clients across the lifespan. So that starts with an initial evaluation. And so we complete a comprehensive assessment to guide future treatment planning. And then after an evaluation, we provide individual and/or group therapy to our clients with pediatric clients or adults. Many of our pediatric cases are seen in the traditional model that I'm going to be spending most of the presentation discussing. So those cases are related to things such as, but not limited to, speech sound disorders, language disorders, literacy disorders and delays, stuttering, alternative and augmentative communication, and many more. We have many adults in our clinic. Some of them are seen in our traditional model that I'll discuss today, but we also love to have our adults work with our students who are in tries 3, 4, and 5, who are our students who are coming back to our pro bono clinic. So we see adults who perhaps have had a stroke and they have resulting aphasia, or we see adults for cognitive communication therapy related to memory, organization, and problem solving skills. One initiative that we are really excited about in our clinic is in 2024, we received a grant for all of our clinical educators and our students to be trained in the Speak Out program from the Parkinson Voice Project. So we are able to work with clients who have Parkinson's disease and provide them with individual and group therapy. And that is a really beneficial program that helps those clients with not only their speech, but also their swallowing. We also support adults with developmental disabilities, so we provide communication intervention for individuals with autism, Down syndrome, or other conditions. And we provide voice therapy and accent modification and communication coaching. So now that you have an idea of the services we provide, I'm going to really go into the structure, and I think this is really going to be beneficial for those faculty members as you think about how this could potentially work in your own program or ways that we could collaborate in the future. So our model starts with orientation. So all of our students, we want to set all of our students up for success. So Robin mentioned that all of our students participate in the pro bono clinic in their second term. So at the very end of their first term, we have what we call day 0 orientation. And this is basically an opportunity to really set them up for success and say, hey, this is what we're going to work on with you in the next term, and really help them understand what the student expectations are as far as technology, time commitments, things like that. We also talk about key dates, and just give them an overview of what the model looks like. When they come back after the term starts, on day 1 of the term, we have a second orientation where we, again, just review the expectations we previously discussed, but then deep dive into topics like our Clinic Note EMR system, the different documentation pieces that they'll have to work on in the clinic, such as SOAP notes, progress reports, weekly lesson plans, things like that. We also discuss different student assignments, and I'll go into those, and those come into play for day 2. And then we also train them on how to submit their clock hours. After day 1 of orientation, we email out client and student partner assignments. And so after day 1, they get their client assignment, and then they go into our Clinic Note EMR system and they complete a client file review assignment. And this is a structured assignment that we have to help them walk through their Clinic Note file and gain the most important information that's going to be relevant to treating that client in the following week. They also complete an assignment where they watch a video related to supervision styles and take a survey on how they prefer to get feedback and how they work together as a team. And that assignment really sets them up for day 3, where in day 3, our clinical educators come together to talk about things related to, how supervision works in clinical training, and how we are going to be providing verbal feedback and written feedback, and we give them ideas related to self-reflection skills, because we know these pieces are so important for clinical learning. On top of that, clinical educators provide resources to help our students get started with their first therapy plan. So they've now come to this day of orientation, they've reviewed their client's assignment, they have an idea of who that client is, and now we're giving them resources to help them plan for that first session. After we've done all that, CEs then host a breakout room with all of their students, and that gives them a smaller group for those students to jump in and ask more personal questions related to their client or just how their team is going to work together. And it kind of helps students feel a bit more comfortable, and helps them get to know their clinical educator for that first introduction. Now moving into the structure of what it looks like on a day-to-day basis, or first on a trimester basis. So all of our clients, I mentioned earlier that our clients start with an evaluation. So that is done before they come in for treatment. And so all of our students who are in their second term and are who are starting therapy in our pro bono clinic, they walk in with a file and they have a client who has their goals already set based on that evaluation. I mentioned earlier that students receive a client in a partner assignment. So students work in pairs for this experience. And they're also based by time zone. As Robin mentioned, we have students across the country, so we pair our students based on time zone to help make that a bit more efficient as they're working together in a team. Um, what you'll see here is that we have 2 clinic sessions per trimester. So all of our Tri-2 students are essentially grouped in half. And so we have half of the group starting in what we call session A of the clinic. And then we have a transition week where clinical educators meet with those session A students and provide them with a conversation, a self-reflection conversation, and they talk about the student's final grade and the student's progress over the experience. And then clinical educators meet with session B students to help them get going in therapy. But regardless of which group the CE is working with, that client is going to remain the same for throughout the entire term. That way, the client has some continuity of care with that clinical educator, and that clinical educator can make sure that the treatment is appropriate for that client. At the end of the experience, all students complete a progress report, whether it's session A or session B, where that client's goals are adjusted or rewritten based on their progress in that academic term. So moving into our supervision model, one thing that's unique about this experience is that we do offer 100% supervision by our clinical educators. So when our students are working with the clients, their clinical educator is with them throughout the entire session. And we've done this, and it's based on Anderson's model of supervision, where we give them a gradual release of responsibility. So students may first observe a recorded session, or they may observe the clinical educator modeling treatment or an activity just to get an idea of what they need to do before they move forward into that first session. And then as the student is demonstrating more competence with these clinical skills, the CE is slowly going to fade their support. So in the virtual setting, we really love this because it can be as simple as simply starting to mute the mic as the clinical educator, or turning off the video, sending a chat in the background that the client can't see. And so this virtual environment works really well for this model. Um, all of our clients come to our clinic twice a week for about 45 minutes. So students are blocked for the full hour. So they see the client for the first 45 minutes, the client leaves, and then they work with their student partner, the clinical educator, and they have a debrief with the 3 of them to talk about, okay, what happened in the session today? I noticed you used additional visual supports today. What was the effect that had on the client? What are you going to do next time? So we can give them immediate verbal feedback to help them really maximize their clinical learning with that experience. Because as you can see, we've only got 1/2 of a term with them. So we really want to maximize the learning that they're having in this experience. In addition to the debriefs, we have ongoing support for our students in this. So they have a 30-minute meeting set aside with their clinical educators to discuss the clinical topic of the week, which I'm going to go into next. And clinical educators provide individual and group feedback, either verbal or written, in those debriefs or outside via email. So students are getting a lot of feedback during this experience to help promote their self-reflection. Additionally, I am the lead clinical educator, and I send out weekly emails and tutorials that provide video tutorials and additional resources that tie directly back to their clinical coursework in their first trimester. So we're really trying to bridge the academic and clinical learning. So I mentioned that each week in the pro bono clinic, we have one main focus that we are addressing each week. That's not to say students aren't working on skills in other areas, but we're really trying to help them focus on developing a skill before we add in the next one, so that this is well scaffolded for our students. So, and these different skills, these focuses and the accompanying skills are aligned with our pro bono clinic grading form. And we go over that in orientation with our students and week to week. So our students are well aware of what are the areas that we're addressing. So I'm going to go over these week to week with some examples.
And Kelly, before you get into those
Yeah.
week to week, so as far as our grading form goes, I would say it's probably more competency based, and then depending on how they do with that determines their grade. So we do have, you know, it's very outlined on our form, but it's each week that are competencies that they have to demonstrate or demonstrate by the end of the trimester, and the skills build upon themselves each week. And then that goes into a grade because we have to put a grade into the course, but that is like the grading component.
Thank you, Robin. All right, so I've talked a little bit about week 0 already, so that is orientation week. And that's where I've mentioned these 2 assignments that they've been working on so far. So the focus for that week is to review the client's medical record and prepare for that first session. So that will include skills such as going into Clinic Note and reviewing your client's medical chart to obtain the most relevant information. And then also preparing a client caregiver interview with open-ended questions. So you'll see here in that week 1 lesson plan that I've got here on the right, we've got a prompt for them to list interview questions there. So we really try to help our students fine tune all the information because some of these clients have been with us now for years and there's a lot of information in that report. So we really want them to be set and ready to go for that first session with the most relevant information. And then given that week 0 assignment where they go through and they create the client file review and they create the parent interview, they meet with their client for the very first time in the following week. And so they conduct that caregiver interview and they also have some rapport building activities. So this week focuses on, again, developing rapport, but it also encompasses a handful of skills, those being caregiver interview, being able to demonstrate and establish rapport, being able to prepare an activity based on what you find in the client's file and based on what you and your CE report or what you discuss in your initial meeting, and the ability to take some simple data. In future weeks, we really fine tune their data collection skills, but at this point, we're really just hoping that they can take a client's goal from the file and just make a basic judgment of is this goal still appropriate? Am I seeing what I expected to see? How is the client responding? So it's some very early ideas into data collection. So here I'm going to show a quick video of what it looked like for those students who prepared a caregiver interview. For the sake of time, I'm just going to play a few seconds of each video, but I wanted you to get an idea of what this looks like.
Have you seen any regression or progress just over the holiday break with her goals?
I've seen progress because she talks a lot. She talks a lot, and so she's been able to, I don't know, just even with all the songs, it used to be singing was kind of hard because people just, singing goes fast. Mm-hmm. And so she couldn't keep up. And now we went Christmas caroling at a nursing home and she's able to keep up. And something as simple as being able to keep up with everyone singing might seem like not a big deal, but it used to be something she would struggle with. So she would kind of start with the beginning of this.
So there you can see they've come prepared to that with very intentional questions so that from the beginning, students are leading these activity sessions, and I'm there to support them, jump and ask follow-up questions if need be, or answer parent questions. But one critical part of this experience is that we want students to feel that self-efficacy from the beginning and feel prepared to get going. Also, as part of that experience, as I mentioned, they're developing a lesson plan with some of those initial activities just to get to know the client based on the client's interests. So for example, this client that we were just referencing, she loves to bake, and so they had a little baking activity with her, and then they had some activities related to her goals that were written. Then we move into week 2. So this is where we focus on helping the students fine tune their ability to plan sessions and create activities to address goals and focus on some early teaching skills. So some clinical skills that we're looking for in this week would be to have the students develop setting appropriate intervention plans with relevant activities and measurable and achievable goals. We also hope that students are selecting and developing and using appropriate materials. And then also, this is where we really start to focus on data collection. So that's the topic for the 30-minute weekly meeting that I mentioned before. We pull the goals in for that client and we say, okay, if you've got a goal related to ER in the final position of words, how are you setting up your data collection sheet and how are you going to efficiently take data in the moment? Because when you move off to your externship, you're not going to necessarily have a recording to go back and collect your data. So we're really trying to help them develop these skills in real time. So here's an example of an activity that I believe they're working on her ER. So I'll play a little bit of this.
Player, 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 player,
One more time, let me really hear that.
player.
Great job. Okay. Now we're past the training level. Now it says
So I'm going to pause this here. So this was just an example. This was like a little detective game that they were playing. So she was saying the words first, and then she was trying to figure out what the clues were to open up this puzzle at the end of the activity. Fortunately, I can't play the whole thing. It was about 15 minutes long, but it was again, the focus this week was really trying to help them develop, okay, these are the target words that I've set out, and I'm going to try to collect my data in real time, because that's something that our students have reported to us many times, is that feels really intimidating for them at this point, is they often rely on the recordings and they need to be able to collect that data in real time. So we talk about structuring that to make sure that they can do it all at once.
maybe hiding 3 words.
It's trying to play on me again. Okay. Then we move into week 3. So again, I talked a lot about data collection in week 2. Now I want them to more confidently and independently report the data in their SOAP notes. So they've been writing SOAP notes beforehand, and we've been giving them lots of support in previous weeks, but now we want them to grow more independence in this area. So we're asking them to being able to use that data and report it accurately in the O section, and then analyze it correctly in the A section. And we made this a weekly focus because as we developed this pro bono clinic over the last few years, this is an area of clinical practice for these students early in their experience that we found that this was one of the more difficult areas of differentiating the O versus the A section, and not simply repeating observations in that A section, really developing their clinical and critical thinking, and describing what that data actually means and what treatment needs moving forward. So moving to week 4, now that they are more confident in planning activities and running sessions and collecting data, now we want them to use that data and use the A section of their SOAP note and actually use that to inform their treatment and how they respond to their clients, and within the session and as they move toward the next session. So the focus is really on cueing and scaffolding, and being able to have the client respond to you and being able to modify what you do according to the client's response. What I also want to point out about this recording is you're going to see at this point that I'm off camera. So probably in week 2, maybe week 3, I would have started fading out my mic and turning off my camera here and there to give my students more independence. And by week 4, my camera is off for the most part, and I am just jumping in with comments here and there to provide them extra support.
I put butter on toast.
That was awesome, Lucy. Good job. Can you click on butter? Nice work.
Number.
Number. What's something we could say about numbers?
There are really big numbers and really small numbers.
There are really big numbers and really small numbers. So I heard the ER in the last numbers that you said. Can you say that whole sentence one more time?
There are little numbers and big numbers.
Oh, did you hear how you said it differently? You said there are little numbers and big numbers. I heard the at the last one. Can we say it one more time?
There are little numbers and big numbers.
Nice work, Lucy. Could you click on the word number?
Right. So again, we're wanting to make sure that, if the client presents with a target that's not quite what we were expecting, that they're responding and providing that cueing and getting multiple repetitions there, rather than maybe in earlier weeks when she might have heard numbers and said, okay, good job, and kept moving. So we really are hoping that they're developing more of that independence to jump in. All right, and then it all finishes up in week 5, where the focus is to summarize the progress report and counsel the client and the caregiver. So in this week and leading up to this week, they write a progress report that I previously mentioned. They also write new goals or modify the goals that are already written according to the client's present level. And then they go in and they counsel the client on that progress note. So in that progress note, they also talk a lot about home carryover activities and ways that they can support the client either during that transition week or between academic terms. So what you're going to see here is our students going through just a small snippet of this counseling portion, and they are doing this with a great deal of independence.
Been practicing that ER ending sound in the final position of words, and given minimal verbal and gestural cues. She's currently met this goal, so go Lucy. And then the second goal is we've been practicing reading words and short passages.
I'm going to skip a little bit as well so you can see the recommendations portion as well. Let's see if this is going to load for me.
Her ER words in different tones, because we noticed she was sounding a little robotic in the beginning. Like she would say teacher, water, just kind of sound like a robot. But when we gave her a cue of like what way we want her to say it, she responded really well to that. So that was really helpful. And then when we got to goal,
so you can just see that it's really just a conversation that, by this point, they've worked with the parent week after week. They've started doing parent debriefs at the end of every session. So by the time they get to this conversation, it's hopefully a summary of what they've already been talking about session after session, but it's also a nice moment to really check in on the goals that they've provided and make sure that the parent is in agreement with those. And this is probably one of the sections that our students, at least in my experience, report to feeling maybe the most nervous about. And so I'm really grateful we have this intentionally built into our structure here, because but at this point, they've had several weeks of talking to a parent, getting comfortable with a parent, and really counseling them. Are we ready for discharge, or are we going to continue therapy? And what are my clinical recommendations moving forward? Do you agree with me? And how am I going to respond to you, whether if you do or you don't agree? So I think the students really benefit from this experience here. All right. One piece I don't believe I've mentioned yet is the observation assignment. So I've talked about how we have 2 groups per term that work with the same client. And one way that we wanted to ensure continuity of care is to have an observation assignment. And this was actually modeled after a few years ago, the OT department was incorporating some telepractice into one of their courses, and we overlapped with some of the clients that we treated. So what we did was we partnered with the OT program, and we had some of our SLP students go and watch the OT sessions and vice versa. And then at the end of the term, we had this grand rounds between the SLP and the OT students who were participating in that experience. And that was always one of the highlights of each term that occurred in, because students really enjoyed getting to go watch peers, even peers in other disciplines, work with that child. And they always learned so much from their peers, and they had a lot to say about that experience. So when we moved over to this AB structure, we wanted to pull in a similar model so that our students could learn from their peers and also work together as a team to make recommendations and ensure that the client is getting the best care. So here's an example of what a debrief looks like on that observation assignment day.
Girl, she's doing really well, and she's doing much better on her regular past tense, because before she would just automatically add the ed, and now I feel like she's actually memorizing them, and then practice she's
or like picking
thinking
up
about
yesterday and today. That's really helped.
Yeah, I like seeing her self-correct while she she was correcting herself as soon as she said it. So that was pretty cool. Yeah.
I'm going to skip ahead a little bit.
To get it right. I feel like she's picking up on it.
She looked so comfortable the whole time, like talking to you guys.
Yeah, she seems like she really enjoys this.
She was really like confident with you guys too, and then she was shy with us, but I'm glad she opened up. Yeah, it's nice when she the first time she started just talking, just
we were like
we're like
yeah, so like a question for all 4 of you: what are some things that you could recommend to a future group to help her open up?
I think just kind of like asking her questions about like her life and her siblings, her family, like what's going on like outside of her sessions and stuff. Like once she starts talking about something that she's interested in, she likes to talk about it.
So I wanted to share this just so I can show the conversations that happen with our students. And I also really appreciate this because this also connects them with more of their peers as they are in this hybrid program. And maybe they're working with peers who live in a different state. And so it's just another way that also builds that community within our program. I also appreciate this observation assignment because in session A, the session B students kind of get to see what's the client's present level compared to what it was earlier in the term. And so they maybe have to adjust the goals compared to what they expected to work on. But in session B, when the session A students come back, they get to talk as a team of 4 about, what are the next steps for this client? The client's going to have a 6-week break. So what are we going to do as a team to make sure we don't have regression in therapy between academic terms? So there's just some really great conversations that happen between our students in this experience. Okay. One piece that I get from either our SLP students in the department or when I talk to people in other disciplines related to teletherapy is how do you engage a client during teletherapy? Because that's great for this client that I've been showing y'all who's 10 years old and has been with us for 3 years and can sit in front of a computer for 45 minutes. But what do you do for those clients where they're working on goals that don't seem like they work really well with teletherapy, or they're really young and they can't sit still? So I wanted to show a couple of different examples. So this first one thing I always say is the importance of involving the caregiver. So in this example, we have just an itty bitty little one here. She's, I believe, 4 at this age. And she was working on a lot of her fricative sounds. So F's, S's, things like that. And they were very quiet. And so they were a little bit difficult to work on via Zoom, but they were extremely important based on her. We need to increase her intelligibility. So what we did is we talked to her mom about, what would be a correct production that we would expect and what would be an incorrect production. And so you'll see in the recording, her mom is sitting there giving us a thumbs up, like, yep, that's correct. Let's keep moving forward, because you'll see the student clinician didn't have her boom mic on this day. She got a boom mic in future sessions, but so Zoom often would cut out her sounds for her. So having that caregiver involvement and helping her mom know what we're looking for not only helped her help us within the session, but then she was doing a lot more home carryover because she knew what to look for, and she was also helping in jumping in and queuing within our sessions. So it provided a lot of great carryover. So here's an example of that. Ready?
Good job.
Oh, they're getting closer. And the good job. Oh, look how close they are. I bet the bunny's scared.
Nice.
Good job.
Can you go back real quick, Katie? Nice job, Catherine. Can you go fa?
Good job.
You did, Catherine. So you can see that parent, having that parent support, there were a couple of times she was able to jump in and provide us that feedback so that we could keep her engaged, and we were also providing correct feedback in that moment. All right, and then this is just a simple example. This little one, as I mentioned, she was able to sit for a couple of quick activities for us to get high trials for this articulation practice. We needed lots of good trials for her to, make that progress, but that was hard work for her age. So we incorporated lots of movement breaks. So she really loved to do the hokey pokey, and so we incorporated that. And I'll just share a couple seconds of this. Hokey pokey, and turn yourself around. That's what it's all about. All right. For the sake of time, I'm going to keep moving on that one. So another thing that we wanted to pull in was, I think parent coaching is often something that can be really beneficial in this setting. So again, working with what the client has in their environment. So a lot of our students, when they first come to work with us, they want to incorporate activities that are, on websites and on the screen for the clients. And that can be really great for a lot of our clients. It can be really engaging, but that doesn't work for all of our clients. So here's an example of a client that we worked with who could do a couple of those games at the beginning, maybe if we wanted to, again, collect as many trials as possible, but then we wanted to move more into coaching with his mother so that she could facilitate the same language at home. So I'm going to show a first part of an activity where I was introducing this concept to the students, and then show later when the mother was doing this in a separate session after multiple sessions of us doing this. So Vanessa, tell us a little bit about what he normally does with the magnetiles, or how y'all normally play together.
We'll usually either make a house or like a tower. So I'll usually like let him know, like depending on what we're building, I'm like, okay, put it here, stack it or up. And then we'll have like a little, like a fire truck.
So you can see we're trying to get an idea of how they use this already at home, and the ways that we can make some modifications to really develop and relate to the goals that we're working on with him, which was at this point, we're trying to get him to use more word combinations. He was speaking in single words at this point, so we wanted to support his growth there. So this was later on with a new game that he really loved at home, and his mom was asking us, like, what are some things, I don't really know what to say when I'm playing this with him. So the student had talked through some different phrases with her, and then you can see the mom using these phrases in this clip.
Did it pop?
No.
It didn't pop.
I want eat that.
Yeah, that's it.
Yeah.
Yeah,
It popped.
it popped.
So that was just a really fun case, because I can remember when our students worked that first session, they had all these websites pulled up, and he was, he's engaged in some of them, but 45 minutes in, he was having a really tough time, like sitting in front of the screen. So this was a way to pull him back in and keep him really involved in the therapy. So that was a fun experience. Okay. I'm going to just briefly touch on this because I want to make sure Robin can get to the impact of our clinic. So that was the full model that all of our students in the program go through. And so Robin also mentioned that we also provide additional opportunities. So if students in tries 3, 4, or 5 need to supplement either their clinical clock hours, or if maybe they need a certain competency, like they haven't gotten enough adult voice evaluation hours, we can use our clinic to help support those students. I mentioned the Speak Out training grant that we've used in the past, or I believe I've mentioned it. So we have that training grant where all of our clinical educators and our students are trained on this. And so that's an initiative that we're trying to grow in our program, and it has been really wonderful for both the community and our students. We also started an aphasia conversation group that students can get additional competencies with. And then we also provide those evaluations, because those evaluation hours can be tricky for our students to gain in certain settings. So I'm going to pass it over to Robin to talk about impact.
Yeah, so in 2024, we had 257 students that came through the clinic. So they provided therapy and evaluation. We had the combination. So it was just neat to have that many students who were able to have that opportunity. They really gained that foundational treatment experience before their first externship experience, because that was that hands-on where they got to work with a real client. And then having that 100% supervision from their clinical educators. So we have 4 full-time clinical educators, so Kelly, and then 3 others, and then we also have a part-time clinical educator. And so that is our team that makes all of this happen and implements this each week. And so they really get to develop those key clinical skills. So that interviewing, that coach reading, that's something that we have to work through a lot as well, because as you probably know from group assignments, sometimes it can be difficult working with others. So they have to figure out how to coach read and session plan together, collect data, document, and then provide that counseling. They also get the telepractice experience. So, a lot of times in a lot of other programs, they're just going to their externships to where they're getting the in-person experience, but our students get a combination of that, both the telepractice with us and then at their externship. And then there's supplemented clinical hours and competencies that they need. So, we're able to provide evaluations, we're able to provide therapy, and some of these are in low incidence areas. Like, sometimes they go to externships where they don't see a lot of clients who have voice difficulties, and so they can get that experience in our clinic. So that's the impact on our students. And then these are just some examples. We just put a few of these quotes up here that our students have said. Usually get really positive feedback from the clinic. The students typically report really enjoying it. It was a great learning experience. It was the first with a real client. I felt guided, but also had a lot of independence to experience what it's like to hold a therapy session without my CE. And so that's, kind of shows that model that Kelly was talking about with our supervision models. I felt like that was good feedback with that. I appreciate the experience. It's allowed me to apply what I've been learning from the coursework and practice in a real world setting, which we appreciated that because we're so intentional with trying to bridge that gap with what they're learning in their courses, with what those clinical skills that they're practicing. I learned so much about myself as a future clinician in the realm of SLP as a whole. And so again, learned a lot about myself, very helpful feedback taken to my externship. I loved working with my partner to bounce ideas. My fee was always so encouraging. So those are just a few pieces of feedback that we've received.
Perfect.
So the impact on our community, 38 clients received individual therapy, and we had 28 clients who we evaluated. So again, this was in 2024. So a lot of our clients do continue each trimester, and then sometimes we get new clients. We were able to launch 2 therapy groups. So we had an aphasia conversation group, and then as Kelly mentioned, the grant with the Speak Out, which we applied and received the grant to extend for this next year. So we'll be able to continue to provide those services. So a group for Parkinson patients, and we serve clients in Texas, Florida, and California. So our CEs, we have to be licensed in those states to provide services. We have to be licensed wherever the client is located. And so those are the 3 states that we are taking clients from. And so again, we kind of talked about this earlier with, we were able to provide, we are able to provide services to clients. They do have to meet eligibility criteria. So that could be if there's something with their insurance, no insurance, or lack of therapy coverage, or maybe their limits are met. There are Medicare, Medicaid restrictions sometimes, so that limits their therapy that they're able to get, so their benefits are maxed out. And then the affiliation with universities. So we love having faculty, staff, family members, students. So as you are working with students and you see any of difficulties that we talked about in our clinic, Kelly had that first slide at the beginning that talked about all the services that we provide. We're more than happy to help with that, as well as any family members or faculty. And these are just some of our quotes that our clients have talked about. I can't say enough about how impressed I am with this program. It's been so beneficial for my children, but also so enlightening to my husband and me. My children were provided with engaging instruction and given lots of insights to their progress as well as the sessions went along, which again, I'm glad that Kelly covered on the engaging piece, because I think that's something, it's like, how do you do this with teletherapy? And so, she showed some examples, and it's nice to get some of that feedback. I see it as a win-win, good for students and participants. Students are really energetic, which is wonderful and contagious. I appreciate the digital resources submitted outside of the session so we can work as a family with our child. I appreciate the time of each session to communicate with the parent progress and areas of improvement. So Kelly, went through those different skills that we're working on with the students. Then you can see the feedback from the parent. It's also beneficial for them to receive home programs and that counseling at the end of the sessions, as well as the progress as they're moving along. And then with our department, so again, we are super grateful that the university supports this. So not only can we have the impact on the students, but then also the community and being able to serve the clients. And so with our department, we're able to train these students on those foundational skills before their externship, which we talked about. So again, they're getting this information in the coursework, but to be able to see them apply it is a whole nother skill. So we're able to do that. Our students are given an experience with treating a client prior to that externship and experience with teletherapy. It gives us an in-house clinic. So sometimes we have what are called growth and development plans. So sometimes if students need additional support with their clinical skills, then we develop what's called a growth and development plan, where we will identify the skills that they need additional support in, and then we put in resources as well as some different things for them to do to work through that plan to hopefully help gain those skills and to really be able to demonstrate those skills. And so this provides a opportunity so our students can participate in the clinic to get some additional support if needed. It also gives access to opportunities for students who haven't met those minimal hours or competencies of their externship. So as we talked about earlier in that try 3, 4, and 5, when they're at their externships and they need additional experiences or hours, we can do that. It allows us to provide services to students in other disciplines. So as we stated, we like to serve students for the university. So we're really, relying on faculty and staff as they are working with students, they identify something, passing along their information and doing a referral. And then that interprofessional collaboration that can occur with other disciplines. So we are very open to this. And again, like I know sometimes we have the barriers of the models and the different programs that are out there, but we are willing to collaborate and see how we can work through it. So as Kelly's mentioned, we've done this with OT before when it was incorporated in the course. And so, ahead of time, we just were able to work through the schedule. When are we going to schedule these collaboration meetings, and how do we want to make that work? And so we're very open to doing that. We have some flexibility with the schedule that we can for the certain flexibility that we can work, but we appreciate the conversation and at least want to get started. So if you or anyone would like to collaborate on that, please let us know.
All right. Do you want me to take this, Robin? Okay,
Yeah.
perfect. So I'm going to finish up with some future directions. So Robin talked a lot about IPE opportunities. We're really hoping to build that in our clinic. I've mentioned our Speak Out program for Parkinson's patients. A lot of those areas come from a similar referral source that the Miami campus uses. So in the PT clinic specifically. So that I think would be a really easy place for us to get some IPE experiences for our students. We also have many pediatric cases, and I mentioned that we used to partner with OT in that experience. I'm sure there are referrals we could be making out. But if you also are seeing clients in your on-campus clinics that you think could benefit from speech and language services, we would love if y'all referred to our clinic, but then also if we could partner together to talk about that case and give our students that experience. Another thing I've mentioned when I talk to professionals in other disciplines is, I don't know if I could make this work from a teletherapy setting, especially related to evaluations. So for those other disciplines who are on campus and have your on-campus PBCs, I think one thing that we could consider is offering in-person evaluations in those disciplines, but having ongoing telehealth services and having us collaborate on those as well. From the SLP side of things, we're really hoping to expand where our clinic is going next. So we have one clinical educator who's hoping to start an adult social skills group this summer. We also have a clinical educator who wants to start a Speak Out group, so that group with our Parkinson's patients, specifically for Spanish-speaking patients. That's been a big demand that we haven't yet had the ability to fill, but we're hoping to start that this summer. And in future summers, we hope to start like a summer literacy group. Another thing that this pro bono clinic I think would really allow us to do well is to partner with academic faculty on their research. So our SLP faculty has already been reaching out to us about their research interests and ways that we can connect as a team to support their research and also support our students in gaining some new experiences. So that's where we're hoping to go next. So we have a couple minutes left. I wanted to end here with questions, but before we jump into that, I just want to mention if there's anyone that you know who's interested in receiving our services or could benefit, you can have them contact the probono.austin@usa.edu. That is our home campus, even though we're virtual, but they can reach out to us via that email and we can get them the intake information. And if you're interested in collaborating, please contact Robin and or myself, and we would love to talk about ways that we can partner with other disciplines. All right, and so we have a couple more minutes if anyone has questions.
Okay, no questions.
All right, well, if there are no questions, then we really appreciate your time and thank you so much for being here today.
Have a great afternoon.
Thank you so much.
Thanks, Barbara. Bye-bye.
Thank you.